So good afternoon and welcome to the Oral Health Family Information and Provider session. My name is Diane Prenzel and I am with the Delaware Readiness Teams. And we are a Birth to Age 8 initiative, and we bring together early learning providers, community members, school representatives, and families to help children be ready for school and for life. We do focus on the topics of school readiness, healthy children, and parent empowerment. So before I introduce our presenter, we have a few housekeeping items, and that would be that this session is being recorded and will be available for those who are unable to join us, and also for you to view later if you wish. After this session, you will receive a follow-up email with a link to the recording and additional information that's discussed. Part of this session, we will listen to an overview of this topic of oral health, and then we will have time for questions and answers, so you can feel free to put any of those questions in the chat as the presentation is happening, and then we will also follow up at the end. We also ask that you put yourself on mute while the presenter is talking, and then you will have an opportunity to take yourself off of mute during the question and answer portion. So I'm excited to kick this off. Listening to families throughout the state, we've heard many questions about oral health, and we're excited to explore this topic today. I'll be the first person to admit that I have 2 boys, and I've had many questions about this topic, specifically like, when do I take my child to the dentist? And I've also had no idea of the impact that oral health had on overall health. And then these recommendations have changed over time. So with that said, we want to jump right into this topic, and it's my pleasure to introduce to you our presenter, Dawn Walsh. Dawn has been a registered nurse, a registered dental hygienist since graduating from Delta Community College. Prior to college, she worked as a dental assistant, and she finds it hard to believe that she's approaching 40 years in dentistry.
All right.
Dawn worked in the general dentist office practice for her entire career until 2019, when she started her current position with Delaware Smile Check. She enjoys this new career path in public health and wishes she had found it sooner. Dawn loves being a part of the solution regarding health equity for all people. She's a mom of 2 sons that are now 19 and 20, and one's in the Army and one is at home in virtual college. And I would like to introduce you to Dawn Walsh, a registered dental hygienist with the Bureau of Oral Health and Dental Services. Take it away, Dawn.
Oh, thanks, Diane. Yeah, 40 years is a long time, right? I don't know how that happened. Yeah, so as Diane said, I've been with Smile Check now for about almost 2 years. So what is Smile Check? So Smile Check is a program through the Department of Public Health here in Delaware, and we serve infants through adult age people here in Delaware. We do in-person screenings and education for all folks. A lot of our screenings happen in schools and daycares. However, we also do have some other programs. We started a virtual program this year to try to connect with people virtually. So we have some screening forms, surveys that people can fill out and send to us, and be connected with a case management, a dental health coordinator through that way. And then we try to help connect those people to oral health care here in Delaware. So like Diane said, we're going to talk about the links between oral health and your overall health today. I've kind of broken it down into the age groups, and I'll be giving just some information and then also some prevention tips as we go along for each age group. So I'm going to start with the pregnancy, oral health and connections to pregnancy. So a lot of people think that it might not be safe to have dental care during pregnancy, but actually that is not true. Dental care should be is a huge part of prenatal care. It's really important to have a good oral hygiene and any dental care that you need while you're pregnant, and it is safe to have that. Babies' teeth begin to develop when a fetus is only 6 weeks old. So those little teeth are in there growing. A lot of women, 65 to 75% of pregnant women have gingivitis. So what's gingivitis? Well, gingivitis is an early stage of gum disease where you have inflammation, bleeding, maybe swelling in the gum tissue. Some of it's related to hormones. Sometimes it's related to lack of, good oral hygiene care. But why is it important? Well, moms that have gingivitis have a much higher rate of low birth weight babies, in addition to also having more frequently having early delivery of babies. So there's a connection there with that inflammation in the mouth directly to those two big concerns, because they can lead to a lot of problems, both of those things. Also, untreated gum disease can lead to other problems like diabetes and heart disease, which I'll go into a little bit more in depth later in the presentation. But those two conditions are really dangerous during a pregnancy. Heart disease and diabetes can lead to a lot of problems for a pregnant woman. So again, it's really important to access care during the pregnancy. So kids of moms that have untreated cavities are 3 times more likely to get cavities themselves. How does that happen? Well, we pass the bacteria that causes cavities to our children when we taste their food on the spoon to make sure that it's not too hot, or if we drop that binky on the floor and we pop it in our mouths thinking that we're cleaning it and we give it back to the baby. We're actually introducing the bacteria that causes gum or cavities to our kids. So we really want to stay away from doing those things. Pregnant women that have morning sickness, this is a big problem for a lot of women. So with the vomiting during morning sickness, you bring the stomach acids into the mouth, and those stomach acids can actually damage the enamel of your teeth. It can weaken them, make them more vulnerable to cavities, and it can also make your teeth very sensitive. So then it's hard to brush and floss your teeth if they're hurting because of sensitivity, and then that can lead to the gum problems. So what do you do if you have morning sickness? You do not want to brush your teeth for 30 minutes after vomiting. So you can rinse your mouth with water. You can use a small amount of baking soda and water to rinse with. You can use a small amount of toothpaste just on your finger and use that to just kind of put it around on your teeth and your mouth. But you don't want to use that brush because that's just spreading and actually brushing those stomach acids into the enamel. You do want to make sure if you use the toothpaste that you just spit it out. You don't want to swallow that toothpaste because if you ingest too much fluoride, that can damage the baby's developing teeth. So once you have your baby, how do you care for the baby's mouth? So we have a baby on the meeting, so that's fun. So from birth to 6 months, after each feeding, you do want to clean the baby's mouth. So how do you do that? The best couple easy ways to do that would be to use a washcloth, just a wet washcloth, and just take that and gently wipe around in the baby's mouth to clean after feeding. There's also like these baby tooth tissues. These are baby buddies. A lot of people don't know that these exist. They're backwards, right? So these have, they're just like a little wipe that you can, a disposable wipe, and they have xylitol in them, and xylitol is an ingredient that's also found in it's a sweetener that's found in some things like chewing gums and so forth, and xylitol actually helps to prevent cavities. So that's a good ingredient to have on these mouth wipes. So both breast milk and formula contain sugars. They're natural sugars, but it's the sugar that's in there that makes the milk taste good to the baby. But it's also sugar that can cause tooth decay. So we want to make sure that you don't let the baby feed, whether nursing or by bottle, and not get in there and do that cleaning after the feeding. So when their teeth start to come in, most the baby teeth usually start to come in between 5 and 6 months, those first little teeth. Once those first little teeth are coming in, you do want to start brushing their teeth. So there's some different devices that can aid in brushing with an infant. there are little finger cots. These have a little soft bristle on them. You can use that in the baby's mouth just to get in there and brush those first little teeth that are coming in. There's also a little bit bigger brushes that have the little bristles on there and also have a teething ring on the other side. You always want to make sure you're using a hard plastic for teething, that it's not something that liquids can get inside, because those liquids can get into these teething devices and turn into bacteria and mold, and you don't want your baby chewing on that. So always use a hard teething device. So once they start to get a few more teeth, you're probably going to move over to a regular toothbrush. And we do actually with all of these devices, once their teeth come in, you do want to be using a fluoride toothpaste, and just a very small amount. So if you're moving on to the toothbrush, there's just a teeny tiny bit of toothpaste on there. Because little children, they really can't start to spit. Rinse and spit is about age 3. And we don't want them to swallow the toothpaste because, again, might give too much fluoride, and too much fluoride can damage the developing teeth as well. So we want to stay away from letting them swallow that toothpaste. Most kids need help and to be monitored with their brushing until about age 6 to 7. And even after that age, you still probably need to keep your eyes on what they're doing. We're going to just talk here about baby bottle decay or baby bottle syndrome. You may hear those words. So what is that? So that can happen if you put your baby to bed with a bottle that has milk or juice in it. That milk and juice with the sugars that are in there can just be bathed on the teeth throughout the night while the child's sleeping. And it can lead to severe tooth decay. In other words, like all of the teeth in their mouth get cavities. So it's really important not to put them to bed with a bottle or a sippy cup that has milk or juice in it. If you do need a bottle for bedtime, water, just plain water is the way to go for that. And as far as juices go, we want to avoid juices for young children anyway. Infants up to age 1 should not have any juice at all in their diet. They don't need it. From ages 1 to 3 should be 4 ounces or less. So 4 ounces is only a quarter of a cup. And then age 5 to 6, they recommend 6 ounces or less a day. So that's still less than half a cup of juice per day. And of course, I think we all know about avoiding sugary snacks, gummy bears, candies, high carb foods all do lead to and increase the chances of decay. So when should I take my baby to the dentist? Diane asked that in her introduction. So babies should actually have their first checkup at age 1. There's a lot of great pediatric dentists in Delaware, and they definitely want to see your baby at age 1. If you're calling a dentist and they say, oh no, we don't want to see them, you might want to move on and try to call somebody else because they really need that first checkup. That first checkup is usually still baby in your arms. The dental provider just wants to get a peek in there, make sure that they don't see any developing problems at that early age. They may have them sit on your lap to look at them, but usually there's no procedures done or anything at that age. But it's a good way to get the child started and get them started being comfortable and going to the dentist. So now our little ones are a little bit older, so we're going to talk about young children and their oral health. So little teeth have big jobs to do. The primary baby teeth are really important for a lot of things, of course, for eating and good nutrition. They're also really important for talking and speech development. And then the baby teeth are also really important for holding the space for the permanent teeth. If baby teeth have to be removed early, the other teeth can move into the spaces where those teeth were. And then when the permanent teeth are ready to come in, the room is not there for them. So the baby teeth are really, really important for holding space. So prevention and early dental care is important for kids' physical, their mental, and their social health. Like to kind of tell a little sad story here. In 2017, there was a boy, he lived in Maryland, and his name was Diamante Driver. So Diamante didn't have access to dental care, and he had a dental infection which spread to his brain, and he actually died from that. There were a lot of barriers to care for his family, getting him to the dentist, and the only really, I guess, the good thing that came from his death is that it has changed the way a lot of states and so forth are looking at early dental care for kids and trying to make sure that we're getting these barriers removed so that they can get to the dentist, because it can kill you, unfortunately. It's also, poor oral health can also interfere with kids' learning at school. If they have dental cavities that are causing them pain, they might be distracted in class. They might not be able to sit still. So that's another, reason we don't want to let dental disease progress to the point that kids are in pain. We want them getting to the dentist when they're age 1 and seeing their dentist, on a regular basis, so that we're not having kids that are in pain in school. So how do we help our young kids? How do we figure out how to teach them how to, have good oral health care and so forth? I think being a role model for your kids is really a good way to start that. Let them see you brush your teeth and floss your teeth. Make it a family event. Brush with them brush your teeth at the same time that they're brushing theirs. Take them with you to your dental checkups. If you're a good dental patient, if you enjoy getting your teeth cleaned, it's a great way to let your child get comfortable with being in the office. I would let the provider that's doing it, let them know that you're going to bring your child, because we like to, I always enjoyed when the little ones came, give them a ride in the chair and maybe a goodie bag and just talk to them. And then it's not so scary if they see mom and dad getting it done. And of course, we want to practice good oral hygiene for them. Everyone should be brushing twice a day for 2 minutes. And the flossing, once your child's teeth come in that you have 2 teeth that are touching, you should be flossing those teeth. There's some good ways you can use the little flossers, the floss picks, or you can use regular dental floss. Good way to get access to their teeth for flossing is to lay them down with their head in your lap so that you can see what you're doing. And it makes it a little easier to reach if you can see back there in those back teeth and get that floss in between. Again, starting the regular checkups at age 1. Usually around age 5 to 6, the first permanent molars start to come in. So I is probably going to recommend their sealants on the permanent molars as they start to come in. So you talk with your dentist about that, and then of course the fluoride application, fluoride varnish, as that's recommended by your dentist as well. You want to keep their sugars down and make sure that they're getting good nutrition. So for our teenagers, oral health during adolescence has their physical, mental, and social well-being is really connected to their oral health as well. Oral health things are the #1 reason for bullying in schools, especially for the middle school age kids. Features like, buck teeth, or kids that have cavities that are untreated, or they may have bad breath from poor oral hygiene. Those bullies jump on them and really can make a kid's life difficult. We know bullying can cause things like stress, anxiety, and depression. They cause stomach problems, headaches, insomnia, missed school. So, having good oral hygiene and getting your kids the oral health care that they need can prevent them from becoming a victim of a bully. The other thing I wanted to talk about, a couple of other things during adolescence. One is the human papillomavirus. So what is that, right? HPV, you may have heard of that. HPV is the #1 sexually transmitted disease in the United States. And the transmission of this disease usually occurs during the teen years. Oral sex can transmit HPV and other sexually transmitted diseases, but teens are not maybe aware, and they think that oral sex is safe, and it's not. why do we care about HPV? What's that got to do with our mouths, right? Well, HPV is related to as many as 70% of oral cancers that occur later in life. And it also plays a huge role in cervical cancer, which, you know, can lead to obviously having cancer treatment and so forth, but also cervical cancers, even with early treatment, can sometimes lead to reproductive problems for women. So there's a vaccination available for HPV, and that vaccine is usually recommended for children around age 12. And you think, well, why in the world, you know, your doctor says, oh, we're going to give a vaccination for this STD. My child isn't sexually active. But the HPV vaccine, it's very important that it is given before exposure. It works much better if it is given early before a person is exposed to HPV. So that's why they recommend getting that vaccination at age 12 rather than waiting until someone is older and is sexually active. They may have already been exposed and then the vaccine doesn't work as well. So definitely talk to your medical provider about getting that vaccination for your child. They're probably a really good resource for any questions you have about that vaccine. So another thing, you know, and during the teen years, we get kids start doing things that we wish they wouldn't. And the use of e-cigarettes and vapes and juuling and those devices that usually starts with the kids, it's very high starting. The use has been very high recently with the middle school to high school age group. They think that this is a safe alternative to smoking, and it's not. I think we are starting to get that message out there to kids, but they really did think that they thought that it was safe, but it still contains nicotine. Nicotine is a highly addictive substance. It can cause problems with brain development. They also contain a lot of other harmful substances in these e-cigs and vapes. And it may, teen being, you know, starting to use that, it may be a gateway to them starting to try other drugs as well. So it's really something really important to talk to your child about that. Again, I think at this point, I might say that being a role model for your child is really important. So if you are a tobacco user, not letting your children see you do that is going to go a long way to them not picking that up and starting to use that. And also just having an open, you know, willing to have open conversations about that is really important. The e-cigarettes, the effects in the mouth, they can cause oral cancer, just like other tobaccos. They cause dry mouth. They can cause oral lesions. The flavorings that are in the juice or whatever that's in these, they can also weaken the enamel of the teeth, making them more susceptible to cavities. People that use these have a lot higher rate of plaque in their mouth. Plaque is the bacteria that it grows in our mouth. So that can also lead to gum disease and cavities. So some prevention things for teens, and we already talked about talking with them about the tobacco cessation, education about that. Safe sex and abstinence conversations are important to have with your teens. And of course, the good oral hygiene, brushing, flossing. Teens can use mouthwash. Having their regular checkups. Talking to your healthcare provider about the HPV vaccine and getting that vaccine for your child. And if the child does have to have braces, they may need to have increased home care. In other words, they may need to brush more than twice a day. Most kids are, you know, getting the braces during those early teen years. So we want to make sure they're doing their home care. So moving on to the adults, which I think a lot of us are in this adult age group. Oral health directly impacts risks for a lot of conditions, a lot of health conditions that we have. If you have periodontal disease, you're 2 times more likely to get heart disease. So what's the connection there? So they think that the bacteria that causes gum disease enters our bloodstream through the bleeding of our gums. And those bacteria actually attach to the blood vessels that in our body, and that leads to coronary artery disease. If you are diabetic and you have gum disease, it is really hard to get your blood sugars under control. So we know that treatment of gum disease leads to a drop in blood sugars. So good oral hygiene and oral care for diabetic is really important. People with respiratory problems, inflammation in the mouth can spread to the lungs. So people that have asthma or COPD or pneumonia can get much worse problems with those conditions if they have periodontal disease. We know that it can cause sepsis and septic shock, which is kind of what we talked about with Diamante driver. Dental infection can lead to infection throughout the body. We're finding a really lot of connections with COVID-19 infection outcomes. So if you have periodontal disease, you are 9 times more likely to die from COVID infection. You're 3.5 times more likely to end up in the ICU. And then COVID infections cause a lot of problems in the mouth. People get a lot of mouth sores, infections in the mouth, can cause discoloration of the tongue. There's rashes and lesions that are being associated with COVID. I think most of us have heard of, the symptom of the loss of taste. And then if you have to use oxygen, that can lead to gingivitis and dry mouth as well. So COVID-19, don't want to have gum disease. There's some other developing research about conditions related to oral health for adults. Alzheimer's and dementia. They're seeing that people with periodontal disease have a higher rate of getting Alzheimer's and dementia. We don't know if that's related to the inflammation or the bacteria, but there's definitely some connection there with the statistics. Women with chronic gum disease are 3 times more likely to get breast cancer. So there's a lot of connections to things that you might not have ever thought about. Some people think that their teeth and their mouth is just a separate part of their body, but it really is connected to everything and connected to a lot of health conditions. So prevention tips for the adult group, of course, is your good oral hygiene, your regular dental visits, also having your regular medical physicals, seeing your physician, your primary care doc, and getting your blood work and your blood pressure checks and all of that, because it's all connected, and we want to make sure that you're not missing something. And of course, healthy diet and exercise. I think we all hear about that, but that is healthy diet and exercise can actually affect the health of your mouth as well as the health of the rest of your body. So when I talk to you a little bit about older adults, so by older adults, I mean older than me. Even though I got 40 years, I'm not there yet. So older adults, the age 65 and over group. So in that age group here in the United States, believe it or not, we have 20% of adults over 65 have untreated cavities in their mouth. A lot of these folks have limited access to care, either from mobility issues, they have trouble getting to the dentist. They may be in a long-term care facility where there's no dental care available. They may not have the money to go. A lot of folks over 65 live at or below the poverty level. 17% of folks over 65 have gum disease. So when we just talked about all of the conditions that gum disease affects, so many of those people have those conditions that we were talking about. 23% of people over the age of 65 have not seen a dentist in 5 years. It's a really long time. And then 20% of people that are over 65 have no teeth and or they wear dentures. So you think, well, if they have no teeth, why do they need a dentist? Well, about the median age for oral cancer, to get oral cancer is age 62. So at your regular dental checkups, adults should be having an oral cancer screening done by their dentist. And we're doing those screenings. We're looking at all of that soft tissue during that exam to hopefully to find anything that might look like something that could develop into a cancer before it reaches a stage where it has spread to the rest of your body. So even people with no teeth need to have that oral cancer exam on a regular basis. Depending, their doctors may recommend, their dentist may recommend 6 months or a yearly checkup. But that definitely is something that people need to do. And also, if someone does wear dentures, their dentures should be checked on a regular basis. Our shape of our mouth can change and a denture can become ill-fitting. And if it doesn't fit right, it makes it difficult to eat. And then we have the nutritional problems from chewing, not being able to chew healthy foods, like fresh vegetables and things like that. So it's really important, even if you don't have teeth, to get your checkups. So, and then also, as I said, a lot of the older adults, they have these conditions that we're talking about, a lot of medical conditions, and they take medications to treat these different diseases. So, and a lot of medications cause oral side effects. You can have dry mouth. It can increase, medications can increase the amount of bleeding that you have. There can be an increase in mouth ulcers. You can get oral yeast infections in your mouth that can be very painful. You can have gum overgrowth. The gums actually can overgrow from some medications. And then cancer treatment and cancer drugs can really do a number on your mouth, can lead to a lot of problems with cavities and so forth. And then a lot of conditions like ulcers and so forth also come from oral or from cancer drugs. So just some prevention tips from the oral side effects for medications is to increase your water intake. People should probably be drinking 8 to 10 glasses of water a day, especially if you're experiencing that dry mouth. Of course, your oral hygiene of brushing and flossing, having your regular checkups, like we talked about. And then there are some products available on the market. There's moisturizing mouth sprays that are great for people with dry mouth. There's some mouth rinses, some saliva substitutes that people can use. And then just wanted to talk about special needs patients. So special needs, that is such a broad term. And we could be talking about special needs encompasses everybody from somebody with maybe some hearing loss to a person that is wheelchair bound and can't do anything for themselves. So there's a lot of it's kind of hard to just define what does a special needs person need, because it's so different. There's so many different abilities within that group. And it may be that the caregiver of the special needs person needs help learning how to care for the person's oral health needs. So sometimes they need modifications to the devices that they use, maybe using a power toothbrush or a toothbrush with a thicker handle. And then we also, they should also have the regular checkups. And this can be a challenge, for some people in the population. So we do have a practice in Newcastle County. They practice a technique that's called practice without pressure. So what does that mean? So they actually will bring a patient in, based on their needs, individualize their treatment, and their treatment might mean, so today we're going to bring this person in and they're going to get comfortable with walking into the office and sitting down in the waiting room. And then the next visit might be they're going to walk in the office, sit down in the waiting room, and then they're going to come back and sit in the chair, in the dental chair. And then the next time it might be we're going to show them our instruments. It's kind of based on whatever slow introduction to the dental settings so that they become comfortable and are able to receive dental treatment is sort of the end, obviously the end goal for that. So that kind of covers all of the people. I think we were going to share, we have a resource guide, and I think that's going to be shared either on the website or as a link here in the actual Zoom meeting. So in our resource guide, we have information about how to sign up for dental insurance if you don't have dental insurance, either by trying to sign up through the Assist website, which is the state which would help you to connect to your Medicaid and other benefits that might be available. There's a link for the marketplace, which is where you can purchase health insurance through the marketplace insurance. You can add dental onto your medical, and sometimes that's a fairly low cost. We have information in there about what is covered by Medicaid and the CHIPS programs. If you have that for your child or for yourself, there is an adult benefit for Medicaid now in the state of Delaware. So that's a really wonderful addition. We have links to how to find a dentist in here, either through your insurance company. If you have the Medicaid, that would be Highmark or Americanas Insurance. Both of those companies have links to finding a dentist. We have information in here about low-cost dental clinics that are available in the state for adult care and for kids both. There are multiple ones in Newcastle and up in down in Kenton Sussex County as well. Can you guys hear the baby, the little kids? Okay, so and then also on the last page of our resource guide is the phone number that will connect you to the Bureau of Oral Health and Dental Services. And if you have questions or concerns about something, or any want help, information, help navigating, signing up for insurance, if you call that number, you can get connected to one of our community dental health coordinators, like me, or some of the other ladies that I work with, and we can help you navigate through those things. So that's the end of my presentation. I don't know if anyone has any questions about anything that we talked about, or I don't know, or anything else.
If anybody has any questions, you can feel free to unmute yourself and ask that question, or if you're not comfortable with that, if you want to put something in the chat, you can do that as well. One of the things in the chat is, can you please put the link to the resources here? We're going to definitely send out a follow-up email with all of this information, so you will have that. Dawn, I know when you were speaking, one of the things that came to mind, especially for these families that may have younger children that have never been to the dentist before, but are there any recommendations on maybe things that families should be thinking of when they're looking for a dentist?
Sure. So I think a couple things I would, definitely say. One is maybe talk to your friends and see what their experience has been with the practices, that are close to you. That's always a good way to get a referral. When you call the office, certainly feeling good about the person that you're talking to and that you're getting that positive, yes, we do start seeing your children at age 1. That's another good thing to look for. As I said, a lot of general dentists don't want to start with the children, and they will tell you, oh no, we don't start with them until they're 3 or 4 years old. And really that's too late. We need to get them in there at that age 1 and get them started. So those are two really important ways, I think. I think that the referral from friends and family is a really good way to start, because if you have friends that have kids, you can talk to them and see what their experience has been. Barbara, I think I saw I'm trying to learn how to use the chat. How can I get my young child to brush their teeth? That's always a challenge, isn't it? So I think that we talked about during the presentation the role modeling, maybe doing it together as a family, everybody brushing together at the same time, I think is a great way. You don't want to necessarily force it, but they do need to brush their teeth, right? So it's just like they do need to get their diaper changed. They don't like that either. They may fuss and cry when you do that. But it's still something that you need to do. There are toothbrushes that sing songs. There are apps out there that you can download that have songs about brushing their teeth that you can play while they're brushing. I often had made my brushing routine with my boys was part of bath time routine. So we actually brushed while they were in the bath. So that's some of my suggestions. If that answers any question or not.
Yes, thank you.
Okay.
I think to piggyback on that too, what's the recommendation on, you talked a little bit about like the kid toothpaste, but what's that transition process from when children should just be using the bristle to when there's some type of toothpaste introduced? Do you have any recommendations on that?
So yeah, so you should be using a really small amount of fluoride toothpaste as soon as they have a tooth. So there was a time that we were not recommending, it's kind of gone back and forth. So we recommended not using fluoride toothpaste for children a few years ago, but that recommendation has changed. And I'm sitting here playing with the little baby toothbrush. So I'm gonna show you what, since you asked. And I have toothpaste, little kids toothpaste. So, Crest, you wanna look for that ADA seal on the back of the toothpaste. So it's gonna say somewhere on here that this is the approved toothpaste. Basically, if it has the ADA seal, that means it's a fluoride toothpaste. Any of your major toothpaste brands, Crest, Colgate, AIM, they all have fluoride. And then, most of them have the kid flavors. I would definitely recommend using a child flavor for your kids, because there's strong mint flavors. That's a lot for a little kid. So if you have an infant that has one tooth, right? Like if you have, where's my camera? So I just put like barely a smudge on there, right? It's not a dollop. It's just a little bit of toothpaste. So if they have one tooth, you're going to be at that point. When a child is maybe around age, I would say 1.5 to 2, you're going to start to see the first molars coming in. So then they're going to have all of their front teeth, most of their front teeth. And so definitely by age 3, you're going to want to transition to a regular toothbrush. And like I said, it may be at 1.5. I would say 1.5 to 2 years old is when you're going to go to a regular toothbrush. And then you're going to use that small pea size amount of toothpaste. But as soon as they have teeth, you want to get a little bit of that fluoride toothpaste on there. Does that answer your question?
Yes, thank you.
Okay.
And then I guess to that point, just because I've had kids and the recommendations have changed, is there a certain time when like all of these guidelines are looked at, or is it just like pretty fluent as far as when these recommendations come out? Just questioning, as as parents and you have kids of different ages, I just wasn't sure if it was a set standard yearly it was looked at, or if yeah.
I think that it probably goes longer than yearly. I don't know exactly. These recommendations do come through the ADA, and of course, how do we make recommendations? Well, a lot of our I just saw another question pop up on the chat. It distracted me. I'm easily distractible. So, public health certainly collects a lot of data on the kids that we see, right? So, and then, the powers that be that make these recommendations look at that, at the data, how many kids were having cavities. We stopped recommending the fluoride. The reason is because if a child ingests too much fluoride, it can actually discolor the teeth. It can cause white spots or brown spots on the teeth. So too much fluoride is not a good thing. We have other sources of fluoride in our diet. I often say, and I don't know that this is true, but it's something that I thought of over the years. So, we all went to drinking bottled water some years ago, right? We used to just drink it from the tap. And you might think, so if your child is swallowing fluoride toothpaste and you're buying a bottle of water that was bottled from some municipal source somewhere that has fluoride in it too, but it's not labeled that it has fluoride, and then we're giving them a fluoride supplement and we're doing fluoride treatments, all of a sudden kids were having brown and white spots on their teeth. So we stepped back and said, well, let's cut out the, recommend that children that can swallow that cannot rinse yet, like under age 3, we stopped using the fluoride toothpaste. And this was back, I mean, this is going back probably, I don't know, maybe 15 years ago. And so then I think we started seeing more children with decay in their primary teeth, right? So we're looking at those, what's going on? Well, we cut that out. So now we've flipped back and recommended, but the recommendation now is that you only use a small amount. When my kids were little, we were no fluoride toothpaste. Prior to that, when my nieces and nephews were children, nobody talked about it at all. You were using a fluoride toothpaste, and what do we all do with our toothpaste? We put that big ribbon of toothpaste on our toothbrush, right? That's what we were doing for our children, and that's too much. So I hope that answers your question. I don't really know the exact answer to when they review these things or when it comes, but I do know that it's probably based on what we see. So the other question I saw was, what's the difference between a pediatric dentist versus a general dentist? And when would a child transition to a general dentist if they start with a pediatric dentist? So a pediatric dentist is a dentist that specializes in seeing children, children only. They don't usually see adults in pediatric offices. And then a general dentist often sees everybody. However, as I said, a lot of general dentists don't start the children at that younger age. They feel they're not really ready to see the 1 and 2 year olds and will often refer you to a children's dentist. So children's dentists, they do specialized training to become a pediatric dentist. They learn how to work with the kids. So as far as transitioning to a general dentist, if they start with a pediatric dentist, my experience with this kind of varies from different pediatric dental offices. Some offices I have, in my experience in the 40 years, they'll keep those kids through college, right? And then they go, oh, it's time for you to go to mom and dad's dentist, and then others are a little earlier than that. They cut them off right at age 18. And then also, so the children's dentist, the pediatric dentist, so remember their offices are geared towards caring for children, right? So they're decorated to be appealing to young kids. So you may find that your child, when they get to be 15, they're like, Mom, I'm not going to the baby dentist anymore. I want to go to the regular dentist. And that's fine too. But I definitely recommend the children's dentist for the young children. I think once kids are past the age of their braces, needing orthodontic treatment, that kind of thing, going back to the general dentist so that the whole family's going the same place is fine. Did that answer your question, Leanne? Okay, she said yes, thank you.
So, Dawn, this is Barbara. Is it safe for a pregnant woman to have an x-ray, for a dental x-ray?
Yes, so that's a question that we hear a lot because, everybody's heard don't have x-rays when you're pregnant. However, if your dentist suggests that x-rays are necessary, I know the reason we take dental x-rays is because we can't see between the teeth. We can't see into the bone, right? And so as long as they use a lead apron to cover your abdomen where the baby is, it's perfectly safe to have dental x-rays during a pregnancy.
Thank you.
Actually, I have a follow-up question to that. When I was pregnant a couple years ago, I went to the dentist, and when they asked me that question, they actually told me they would not treat me and asked that I basically get permission from my general doctor, my regular general medicine doctor, to get dental treatment. I advocated for myself and I was like, I'm the patient. I can say whether or not I want to get treatment. And, you know, I'm sitting here in this chair, so obviously I consent. But what is the kind of sense from ADA about that? Because I thought that was a very bizarre and almost inappropriate question, because like I was already there and consenting to service.
Yeah, so, you know, there is obviously, you know, dentists do vary in maybe what they're aware of as things change, just like we were just talking about the fluoride, things have changed over the years. And, you know, certainly it is recommended that women have, like I said, it is an important part of your prenatal care to have dental care, and dental care can include having x-rays. I mean, if you had x-rays 6 months ago, then you probably don't need new x-rays, right? If you're going regularly. But if you walk in and you have, you know, a tooth that we think is abscessed, or, you know, could have an infection, the doctor needs that x-ray. And as long as you have the lead shield on, you know, you're protected from that. The other thing that's changed with dental x-rays from 40 years ago is that the amount of radiation that we use to take the new digital x-rays is so minimal that it's like nothing really. There's hardly, and you get more radiation probably walking into the office from the sun than you get from the one dental x-ray. So their x-rays have become more safe than they used to be. So it may have been that the dentist that you saw, maybe they're just not familiar, maybe they don't feel comfortable treating pregnant women for some reason. But yeah, and, you know, we're trying to, there's talk about making dental care part of women's Medicaid coverage during a pregnancy. So in other words, that, you know, the government is working toward, we're working towards not only telling people they should have it, but giving them the resources to get that care as part of their prenatal care. Because there's a lot of things that go wrong if you don't have dental care during a pregnancy. So I hope that answers your question.
Yes, thank you. It was, I actually went just for a general cleaning, so that's why I thought it was very strange. It
Yeah.
wasn't even for x-rays or anything, because I was a regular patient.
Yeah, I think probably it's just, you know, maybe lack of knowledge on the part of the provider, or, you know, thinking old school rather than what, you know, what's recommended nowadays.
Did anybody else have any questions? I see a very good, helpful information.
Thank you,
And
Rondalyn. Thank you.
I'm definitely going to second that. This has been very helpful. I learned a lot of new information myself. So thank you so much, Dawn, for your expertise. We really appreciate it.
You're welcome.
We are going to be sending a follow-up email with the resource links that were discussed, and there will also be a link to this presentation that can be shared as well. And then we'll have, for more information on the readiness teams, on different things that's happening, you can also go to our website for more information. That's www.delawarereadinessteams.com. So we look forward to following up and, you know, continuing to provide information to families on these hot topics so we can all be educated on how to best support our kids and families. So thank you again, Dawn. We really appreciate it.
Thank you. Thanks for inviting me.
Thank you. Bye.
Bye-bye, everybody.